Alzheimer's disease affects over 5 million people in the US alone. We will discuss the causes and risk factors, the stages of this disease and how you can help, the current treatment, and possible prevention.
First, I will discuss the causes and risk factors of Alzheimer's disease. Scientists are aware Alzheimer's is caused by progressive brain cell failure, but the reasons are unclear. It is believed it could be a combination of genetics, lifestyle, and environmental factors that affect the brain over time. Dementia and Alzheimer's are not a normal part of aging, but aging is the greatest risk factor of this disease. Alzheimer's is commonly diagnosed at age 65 and older, but 1 of 3 people age 85 or older suffer from this disease. The risk of developing Alzheimer's doubles every 5 years after 65. Women are diagnosed more commonly than men. A woman's risk is 1.5 to 3 times higher. One of the biggest risk factors is women live longer than men. Researchers are currently unaware of other factors why women develop Alzheimer's more commonly, but many new studies are being conducted to find a link. The risk of developing Alzheimer's increases if more than one family member suffers from the disease. Family history is the biggest risk factor behind aging. Research states someone with a first-degree relative with Alzheimer's is 4 to 10 times more likely to develop the disease than somebody with no family history. Individuals who have experienced serious head trauma are also at a higher risk. Their risk increases if the injury involves losing consciousness or happens repeatedly, like in a contact sport. Other risk factors of Alzheimer's includes smoking, high blood pressure, and obesity. Being overweight can double the risk of developing Alzheimer's. Limited physical activity, lack of mental activity, and poor diet are also risk factors. People who eat few fruits and veggies may have a higher chance of developing the disease.
Next, I'll explain the stages of Alzheimer's and how someone can help with the long-term effects. Stage 1 is known as the normal behavior stage because there aren't any changes noticeable. The only reason that the person with Alzheimer's knows that they have Alzheimer's is because they had a brain scan which detected that their brain wasn't working properly. So our job in stage 1 is to just offer our emotional support as they face the journey of Alzheimer's. Like stage 1, stage 2, there aren't very many changes, and it's known as a very mild change stage. Our loved one may seem to forget someone's name or where they placed an item, but to me, those are daily happenings for almost everybody in life. So just like stage 1, our job is to give them our emotional support and make sure we don't overstep our boundaries so they can live their life without pressure. The next stage, stage 3, the mild decline stage, we begin to notice some changes in our loved one's behavior. Some changes include constantly asking the same question over and over. They have trouble making or keeping plans. They forget to pay their bills or attend appointments and forget what they had just read in a newspaper. We need to give our loved ones space. We also need to offer our help by reminding them appointments, bills, and possibly encourage them to ensure they have their final documents in order, such as power of attorney and living will, because the next 4 stages we will see a major decline in the behavior of our loved ones. Stage 4, the moderately severe decline stage, bigger changes occur than the changes in previous stages, and these changes become more challenging. Our loved one with Alzheimer's starts to forget what day and what month it is, often needs help with daily tasks, such as cooking or filling out paperwork, and often at times forgets things about themselves. So in order for us to help our loved one in this stage, we need to remind them how to do daily tasks and possibly help them to accomplish these tasks, and may need to make important decisions for them. It is suggested in this stage that our loved one no longer drive a vehicle, so we need to explain to them why if they do not understand, and the importance of letting someone else drive instead of them so they don't hurt anybody. The following stage, the moderately severe stage, stage 5, shows a dramatic decrease in the Alzheimer's disease and requires more help from us. Because of the change of independence for our loved one, we need to make sure that they feel as independent as possible. Our loved one starts to forget where they are and tend to become lost because they cannot remember their phone number or address, and they forget how to dress appropriately. They cannot remember important details of their past. In stage 5, our loved one knows they need us, but they will not admit that they need our help. We need to do our best to help them feel as independent as possible. But, however, some suggestions that we can do to help is to leave their clothes out for them in the morning so they can still dress themselves and place notes around the house to remind them of what an item is used for. Making sure our loved one has the proper identification and emergency numbers with them at all times is very crucial in case our loved one gets lost. Last, we also need to explain to them as much as we do why we do the things that we do for them, and hopefully they can maybe understand a little bit as to why we're there. Stage 6 is the severe decline stage. Our loved ones with Alzheimer's start to forget people. Faces may be familiar, but they do not know who they are talking to. They will also confuse people by thinking their brother is their son or their daughter is their sister. They will be confused as to why they're not working or attending school. They start to forget that they need to use the bathroom to eat or to drink. This stage is very difficult when trying to care for our loved ones. At this time, it can be extremely emotional for them and everyone trying to help. It is hard to carry out a conversation, so we need to do most of the communicating. We can use trigger objects to trigger a memory, such as a picture, to try to bring the memory into play. We can tell them stories about their past and show them old family videos. We do have to do whatever it takes to ensure our loved ones that they don't have to be so scared and that they have a sense of ease. The last and most challenging stage of Alzheimer's is stage 7, the very severe declining stage. Our loved one now possibly can lose the ability to walk and may be bedridden or in a wheelchair and no longer has the ability to know and use the basic functions of their body. And because of this, they need around-the-clock 24/7 care, whether in-home, in the hospital, or in a nursing home. Stage 7 is a very difficult and emotional stage for everyone. Our loved one doesn't know anyone anymore and are extremely frightened. We need to do our best to make sure our loved one is taken care of and be strong for them in this final stage. All of these stages require the help and security of everyone around our loved one. As I mentioned before, it can be a very difficult and emotional journey. However, ensuring the safety and well-being of our loved one is our number one priority.
Hi, I'm going to talk about the treatments of Alzheimer's disease, both pharmacological and non-pharmacological. So for mild to moderate Alzheimer's disease, for medications, most of the meds are in the family of acetylcholinesterases, which means that they inhibit the enzyme that breaks down acetylcholine. So one of the possible causes of Alzheimer's is that people have not enough acetylcholine. And so if you stop the breakdown of acetylcholine, it means there's more in the brain, and it can slow down some of the symptoms of Alzheimer's. So two of these meds are Aricept, which is really common, and rivastigmine, also known as Exelon, and they're used to treat, like I said, mild to moderate Alzheimer's. There's only really one medicine that's used to treat severe autism. It's called Namenda, and it is a neurotransmitter inhibitor. So it blocks some of the action of some neurotransmitters that can lead to the symptoms of Alzheimer's. Both of these medicines are proven effective, but only for a short time. So typically they work pretty well for about a year, and then after that the effectiveness really wanes, and then symptoms can either come back or get worse. So for non-pharmacological treatment of Alzheimer's, there's kind of two categories: cognitive therapy and then some other interventions. So for cognitive therapy, there's two types of therapy that are used for Alzheimer's. One is reality orientation therapy. So that is when caregivers, family members, providers, etc., of people who have Alzheimer's make a conscious effort to consistently remind them of where they are, what they're doing, what the date is, the current situation, repeatedly reminding them of what the facts are of their situation. That's kind of opposed to validation therapy, which is more when caregivers and family members speak to the feelings of the patient as opposed to what the facts are. So in the situation where a patient may say, "My father never comes to visit," in reality orientation therapy, a caregiver might say, "Well, that's because he died 40 years ago. I'm sorry he's not here." In validation therapy, someone might say, "Well, I'm really sad that you are missing your dad. It must be really hard not to have him here." So those are kind of the differences there. Other interventions for non-pharmacological interventions for Alzheimer's include PT, so physical therapy, music therapy, regular exercise, animal therapy. All these have been proven to be mildly effective for slowing the progression of the disease and for some verbal acuity. Thanks.
Lastly, I will talk about the possible prevention for Alzheimer's disease through lifestyle choices and diet. For lifestyle choices, it is recommended that a person gets 40 minutes of aerobic exercise per day, at least 3 days per week. And this should be the equivalency of a 40-minute brisk walk. Also, it is recommended to minimize the use of anything aluminum or just avoid anything with aluminum in it. So a lot of cookware, such as pots and pans, will have aluminum, or baking powder does as well, and so do antacids. For diet, it is important to minimize foods that are high in trans fat and saturated fats. Foods that are high in trans fat are usually pastries or anything from a bakery, and also anything that says partially hydrogenated or hydrogenated oils, that is trans fat. Things that have saturated fat in them are milk and other dairy products, meat, and just oils in general. It is important to eat vegetables, fruit, and whole grains, of course, and also having this be the main part of your meal rather than having meat as your main part and then having a side of fruit or vegetables. It's important to get enough vitamin E intake from foods, and especially from foods rather than supplements. So the foods that you can eat to try to get enough vitamin E in your diet are seeds, nuts, leafy greens, and whole grains. It is also important to have enough B12 in your diet as well. It's very important for brain function and other things like that. So a good source of this are lean meats and just anything that's fortified. Usually almond milk will be fortified. And then lastly, if you do take supplements, it's important to try to get ones that do not have iron or copper in them, and only take iron supplements or pills if it is recommended by a doctor.
In summary, I have discussed the different aspects of Alzheimer's disease, the causes and risk factors, progression, treatment types, and prevention. Now with this information, you can distinguish what actions to take regarding this disease.